Anyways, thanks a lot for coming out on this incredibly sunny Sunday, and I think it's really an indication of how much this topic means to us and how much we're touched by this in most of our lives. It's nice to see so many people coming out. My own journey around mental health and addiction first started with practicing law in the downtown east side, and when I was a young criminal litigation lawyer, you do a lot of legal aid, and you tend to have clients from the downtown east side, and I learned very quickly that the people I was working with are really people who primarily have mental illness and addiction, and that's how they interface with the world, and that's why they end up in the criminal justice system. And as a lawyer at that time, it was really frustrating because there weren't a lot of connections to the justice system. It was hard to find ways to actually help your client, and it really felt very much like a Band-Aid solution, you know, helping them get through whatever their criminal matter of the moment was. So I did end up working in the downtown east side after that in developing services and facilities for folks with mental health and addiction issues. But I think the good news is that if we fast forward to today, there really have been a lot of advances in our understanding of mental conditions. And I think we have a lot more appropriate services and treatments, medications that are available to people. We also have better connections between the health system and the justice system. There's much more collaboration that goes on. And some of these best and new practices are what we try to incorporate at Vancouver Coastal Health, and certainly we're doing our best here on the Sunshine Coast. So for example, we know that it's really important to meet people where they're at and to have services that are basically low barrier so that people aren't afraid to come to the services and that are non-stigmatizing. Because it's really a person's own feelings of self-shame and stigma that are what keep them isolated and stop them from looking for help and actually affect their lives in so many ways around homelessness and employment and the ability just to be around other people. And so I think we've heard some amazingly great presentations today on that, and from Victoria, who just really, I think, paints a picture of what it's like. So I just really like to appreciate her for that, because I think it's just so important for people to hear. I also love the words of the last song that we just did, written by Stephen, "Shame on Me." Because it's that sense of self-stigma and shame that it's really a silent killer. I think it's really what really brings people down, prevents them from connecting, and prevents them from getting the help that they really can use. Another area that we know a lot more about is trauma. We know that there's usually some form of trauma involved in being mentally unwell, and either the trauma can be the cause of the person being unwell, as in post-traumatic stress syndrome, or it can actually be the result of having a mental health condition such as schizophrenia, for example. So part of what we try to do in our services is use a trauma-informed practice in the way that we work with people, because it really, I think, helps people to understand and bring compassion to the work that we do. And we really have some incredible teams of people here who are super compassionate. I don't think I work with one person who doesn't bring that level of compassion to the work that they do. Another principle that we work with is the principle of recovery. We know that most people can actually recover from being unwell, and at the very least, they can improve the quality of their lives. And so psychosocial rehabilitation is one of the most important directions in treatment. And when I've finished speaking, we're going to hear from a couple of our team members, Keith Donkersloot and Wes, who is probably the captain of, he's the captain of some of the work groups, but they're going to talk about vocational rehab and the absolute importance of people feeling that they're a productive part of the community and that there's some meaning in their lives by virtue of the work that they do. We also know that it's important to treat psychosis as early as possible and not to wait until the later stages of a person's life. And so last night, the BC Schizophrenia Society had their AGM, and Dr. Tom Eamon spoke at it, so I'm going to steal something from him. But he said, you know, if someone has cancer, you don't typically wait until they reach stage 4 to provide treatment. You would hope to treat them in the earliest possible stage of their illness, and that's really true with psychosis. The earlier it can be assessed and treated, the better the prognosis for the person's whole life. So early psychosis intervention is a very, very important aspect of treatment, and it's something that we will be working on in the future to see what elements of that we can improve in our own system. Families, the connection with families and working with families as one of the most important parts of the system, that's also another really important premise. Vancouver Coastal Health has a family involvement policy, and that means that we are absolutely obliged and benefit from working with families because they bring so much information about their family member who may be unwell. And they're really part of that person's circle of care. They're often living at home, or they're supported in some ways by the families. So we really gain a lot of wisdom from our family members. We do have a family advisory committee, and a number of those folks are here today. Some of them are also part of the BC Schizophrenia Society, and so they really help us in looking at our services and thinking about what we can actually do better. But again, you know, despite a lot of the advances, I think the issue of stigma is still very alive in the community. We still talk about people as being schizophrenics or addicts, for example, rather than as people who have a particular health condition. So I think that's where this type of event is really important in bringing the community out, opening the discussion, and just bringing this issue that is really a health issue out to the forefront. So just to talk a little bit about how our own community is doing in terms of mental health. As you heard already, statistically, in any given year, 1 in 5 Canadians will experience a mental health or addiction problem. And this is the one that surprised me. By the time Canadians reach the age of 40, 1 in 2 either have or have had a mental illness. And so that includes depression and anxiety and eating disorders, gambling disorders, the whole range of things that can affect our lives. We've been really fortunate because looking at our own services, the Hospital Foundation this year gave us some funding to do a clinical services review. And what that has allowed us to do is to look at our current state. How are we doing right now? What are the services that we're providing? To look to the future, to the year 2030, and looking at demographic projections. What will we need by the year 2030 in terms of services for this community? And so the way they did that was through lots of consultations with a broad base of stakeholders in the community. They spoke to families, they spoke to other service providers, the police, the ambulance services, and just a whole range. And so we learned what people are concerned with, and I'm just going to talk a little bit about that. So what the community's telling us is that they're worried about the increasing homelessness and the difficulty in finding housing. Now, I don't think any of these things are a surprise to anyone. And so when someone has a mental health issue, that can be even much harder than it is just for the average person. And it's hard enough, as we know, for the average person today to find housing. Folks are worried about our aging population and dementia. Their perception is, and they're worried about increasing substance use in both adults and youth, and increasing anxiety and depression in children and youth. They're looking for more coordinated child and youth mental health services, and they're also worried about an increased number of women who they think are at risk, and particularly single mothers with children. So that's what our planning for the future is going to take into consideration, and that's just a sampling of some of the things that we have learned through our clinical services review. So I'm going to talk a little bit about what we currently have. And we do have a wide range of evidence-based programs. And what people liked about our services is that we have compassionate and dedicated staff working in quite a challenging environment. I don't know if any of you have seen our mental health offices, but we're in some trailers that are, I don't know, how many years old? 40 years old? Anyways, yeah, so we're living and working in some quite outdated an environment that is not necessarily as welcoming as it could be. We have quite a small inpatient unit as well. What they also liked is that we have multidisciplinary teams who use an integrated approach to care, and that we have lots of positive partnerships in the community. And I'd like to talk a little bit about those partnerships and about some of the other folks who work in the community before I talk about Vancouver Coastal Health Services, because it's really the community organizations that form the fabric of what supports people when they have mental health and addiction issues. Arrowhead Clubhouse, and you'll be able to meet them outside. You may have met them when you came in. The Arrowhead Clubhouse has a peer-based program that supports people to gain skills and enhance their lives. They're a very important place because it's a day program where people can go and feel safe and not judged and have a lot of programming that is very helpful to them. The BC Schizophrenia Society, they're a province-wide family support system for support and public education, fundraising for research, and advocating for people. Erica Gatz is our local coordinator, and the chair is Donna Motzer, and she's here today, and you can meet her when you go outside as well. Donna is also on our family advisory committee. There's the Alzheimer's Society. They partner with us on memory groups and caregiver support groups. The BC Institute of Families for Children and Youth, Jill Shatford is our parent in residence, and she's also here. She's outside, and you can meet her if you'd like to. They do online and one-to-one support for families. I really want to mention our local GPs, because often your family doctor is the first point of contact that people will have when they're experiencing a mental health issue or a family member is. And so the Division of Practice has been working with us to support collaboration and education around services. And one example is there's a child and youth mental health and substance use collaborative group that has just a very broad range of stakeholders. And we meet together to try and do some problem solving around what are the gaps in our system for children and youth, and what can we do better. So that group is continuing to meet, and we're working on different issues. The emergency shelter at St. Hilda's Church, they've been incredibly generous, run by Rain City Housing. There's a seniors planning table, there's a homelessness advisory committee, and a number of other groups. So that, I just wanted to mention those because Vancouver Coastal Health doesn't work in an isolated way. It works and is supported by so many groups in the community, and those groups support our folks who have mental illness. Quick overview before I turn it over to Tim. Our services overall consist of a 6-bed psychiatric inpatient unit in the hospital. We have 4 psychiatrists on the Sunshine Coast. We have Sumac Place, which is a 28-bed tertiary rehab facility, and it is doing some amazing work to help people who have complex mental illness stabilize and be able to live more independently. Some of them are finding employment, so we're fortunate to have Sumac Place here. We have some housing. We've got 4 different houses that are managed by Vancouver Coastal Health, 2 group homes and 2 transition homes that are just opening up. We have a new intensive case management team. I think Tim's going to talk about that. We have a community mental health team. And in terms of how many people we work with, in the last year, we served 485 clients around substance use issues. We have up to 80 people using our opiate replacement clinic. And as we all know, fentanyl is a crisis both in our community and in other places right now. So we're very lucky to have that clinic up and running now, and they're doing some great work with people. We provided counseling for 780 clients. We do case management for 174 people, and Tim will explain to you what case management is. We've had 1,500 psychiatric patients over the last year, and 250 older adult patients. So we are really serving a large number of people already in our community, and according to demographic projections, that's going to go up. So fortunately, we have our services review that will help us to do the planning to try and accommodate some of the changes that we'll need to be making in our services. So I'm going to turn this over right now to Tim Hayward. He's our team leader for the Community Mental Health Group. He's been around for a long time. How many years, Tim?
Oh, too many.
It's too many years. And he's a wonderful clinician, well loved by the community, and he provides great leadership for our teams. So Tim's going to talk about our services.
Cool. Does this thing detach in any way?
I don't think so.
Hello. I was hoping this thing would detach and I could move around a bit. I tend to kind of wander and walk a little bit. I get a bit, I think a little bit better when I'm moving sometimes, so bear with me. I was telling some friends this weekend I was bound to the Sunshine Coast. I had two things this weekend that I had committed to. One was coming here today. I said I was coming here today. There was this fantastic inaugural event happening today, and I was coming after the presentations of Victoria Maxwell, who's amazing, really just gives such a heartfelt and personal account of what it's like to be on the other side, what it's like as from a human perspective, so rich. Vanessa, who's just done such amazing things here on the Sunshine Coast in bringing an awareness of mental wellness into our school systems. Really done good things. Susann, who is just brings such a strong sense of integrity to everything she does. She's here as a musician. She's a member of the community. Strong roots. Really touching everything she does with such a sense of integrity, and that I'd been asked to come and do the infomercial in between these presentations, so bear with me for a little bit. I noticed as I was sitting here, my fingernails are quite dirty. I was gardening, I was pulling weeds before I came. I had three things going for me. Somebody had told me which were the weeds and which weren't. I wouldn't have known. So I knew what plants to target. That was in my favor. The other thing that was going is the roots of these weeds were quite shallow, really quite shallow, and not spread out very far. The third thing was that they were planted in a fresh garden bed. You know that kind of soil you step in and it's spongy and your footprint stays and it's full of mulch. And so I could grab these weeds and pull them out, and they came out mostly came out intact with the roots. And that got me thinking. I came away from there with three things: success in weeding, yes, dirt in my fingernails, and an idea about coming here today and about us all being here today and joined and connected and in some way rooted together by coming here through common interest, through curiosity, through whatever it is that drew us here today. Here we are together in this space, together in a community of us here, rooted. And then I thought, okay, well, that's true. Here we are, rooted here today. Each of us together, brought here by some commonalities together, rooted in a community of us. And then at the same time, rooted with strong roots outside of this room into the world. I have connections in Vancouver, family, woman I'm deeply in love with there, a son in Campbell River, roots that are deep, that run far, that are like these fiber optic cables stretching across the Atlantic. Strong roots of love that carry from us, wherever we are, into the world, that connect us as members of community here, Sunshine Coast community. And that here we are, rooted together here in a fellowship of us in this space here with some common interests, ideas, curiosities, whatever it is that draws us. And at the same time, out into the world and rooted in the community. And so groups like us, Sunshine Coast Mental Health and Addiction Services, we're groups of individuals. We're together with common ideas and purposes, but at the same time, rooted out in interests and activities and friendships in neighborhoods and in bonds and connections of love. And this influences our thinking and the way we are in the world. And then I was thinking, here we are in this room today, joined together in some degree in this space. And then what if we were to divide this room now into rooms? And let's put rooms everywhere. And there's 4 people in a room over there. You have your own rooms, your own doors. We all come in the same space and then go in your own room. And you're over there, you're in your own room now. And you've got your own space, and you've got your own space, and you've got your own space. And then we divide this room into multiple boxes and cubicles of space, and then we find ourselves in bureaucracy, or we find ourselves in big organization. And this is the way we work in the world of health. We come into a big room. 25 years ago, Susann said I'd been here a while. 25 years ago, just before I arrived, there was a room over in that corner. It was called mental health. It was the mental health room, and it was a room in the health system on the Sunshine Coast. There was 2 people in that room then, and a visiting psychiatrist who came from North Vancouver and came in and out of that space once in a while. And then there was another room over there somewhere. It was a bit detached, and it was in the addictions room. It was a separate group at that time. And a variety of other things. The hospital, which was at the time St. Mary's and now is Sechelt, was there in its own space, and so on. And there we were in our different rooms. And then, so here we are, suddenly we're in our own rooms, and we have our own spaces, and each of us has our own walls, and that allows us to get together in small groups and talk about discrete things. And it draws us together in our own sense of community at the same time as we start to lose connections to everyone else around us. Now you can look around and see everybody in this room. I'm standing here looking this way so I can see you. You can see me. I can't see the people behind me very well, but I can see the rest of you. We're all connected here in space, but if I were to divide it all into rooms, we would lose that connection with each other. At the same time, we would be more focused. In specialty, we become less connected as a group. This is what it is for us working in bureaucracy. And so now the mental health room, which 25 years ago had 2 people in it, now has rooms within rooms, until the building was so full that it needed to bring in a portable. And now the portable has rooms within rooms. And now there's another, now we're not even all in rooms in the same space. We're in rooms across the community. We're in rooms over there, and we're in rooms over here, and we have rooms in Gibsons, and we have rooms in Sechelt. And we have rooms that are sort of transient rooms that come and go in Pender Harbor and in Gibsons and other places. And it divides us out into the world. And some of those boxes that we have in mental health now, it's the price of expansion. We have more services, we can do more things. At the same time that we can specialize more, we become more disjointed and more disorganized and more unwieldy. It's the pros and cons of organization and of bureaucracy. So within the mental health rooms, now we have rooms divided by areas of specialty. The specialty in the mental health world are focused on a variety of things. Sometimes they're focused on age. We have rooms by age. We're adult mental health. To get in our room, you need to be 19. Otherwise, you go to some other room. It's in another building. We can tell you where it is and maybe give you the phone number, but you have to get there. It's a separate and discrete thing. So we divide our rooms by age. We see people who are over 19. Then within that group, we sometimes will make exceptions. Okay, we'll make exceptions. Sure we will. But that's really the way it is. You're 19 to come into our room. And then we have rooms of people who provide services to folks with longer-term psychiatric illnesses like schizophrenia and bipolar disorder, and conditions that sometimes involve a disconnection from the world in a gross way within ourselves, and we have trouble knowing what's real and what's not, and it can really disconnect us also from ourselves. So we have people who focus in that as an area of specialty. And we have groups within that room. There's nurses, there's people like Keith and Wes. They do rehabilitation services, help people work, find meaning and purpose in life, and try and do things that give us a sense of connection in the world. Then we have people who are in a room and they do counseling. We have counselors and they're in a different room. And the counselors will focus on anxieties and depressions and various sorts of mental conditions and disorders that typically respond well to counseling as an intervention. And then we have rooms with psychiatrists in them, and we have recently developed a new room, and it has an intensive case management team. And these are folks that will go out into the world, into the community, and help folks with serious discombobulation related to substance use, people who are really struggling, who can't come in and visit us where we are. We need to go out and see them where they are. So we have all these various people working together, providing services, and some things we do well and some things not so well, but mostly we're trying to do a good job. And we're all connected into the community and all trying to be responsive to your needs as a fellowship of us working together. We have folks working with seniors, mostly around dementia and Alzheimer's and things like that, that can create lots of challenges in age. They're providing nursing and social work support, assessments. We have people doing assessments of people's ability to live safely in the community, in protection of vulnerable people being exploited. Under the adult guardianship legislation, we have people doing assessments of individuals' capacity to make decisions, of their ability to live safely and not be taken advantage of by others. We have people specializing in management of severe addiction, opiate addiction, through a methadone or opiate replacement clinic for people. Based on a harm reduction model, the idea that if you're going to do something, at least do it in a way that decreases the impact, the negative impact of harm. And so we have clinics. We have clinics where people come in and they receive substitutions for heroin and other serious street drugs. And we've got Lauren keeping me on track. And she's amazing. And so it's been a pleasure to be here, and the Mental Health and Addiction Services. And really, we want to hear Wes, I think, anyway. It's been a pleasure.
Yeah. Thanks, Tim. I could never have painted a picture like that of our services. That's great. I wanted to introduce Keith because I want all of you to have to experience what I experience every single day. He pops into my office and rants in a good way about the importance of people being able to feel productive in society and being able to work and do something meaningful. So so we know it's got to be brief. And Keith, you can introduce Wes.
All right. Thank you. Thank you, Susann, for all the amazing work you do here. That's awesome. I'm going to give you guys a quick talk about gasoline, community, and the importance of pride and mental health. So, first of all, I'd like to thank the foundation for buying me a truck. I have a beautiful truck out there. And the reason they bought it is because I think I've sniffed too much gas in my life, because I used to have, when I first started my program, and actually I think I was talking to somebody about this, we started mowing lawns for community services, and I had a Mazda 323, and I would haul my lawnmower and a weed eater all over the community and started to expand. And I think I spilled gas once too many, so if I ramble on a bit, it's maybe because I've had too many gas fumes, but anyways, I digress. But what do I do? We provide work for our clients in the community, and we provide a service for people in the community, and we also help out in the hospital, working with the maintenance program. We clean up a lot of the yards. We've done a lot of the bark mulching in the hospital, and we're very proud of that. And our guys are really proud of that. And I have a strong belief that people are able to work, and I work really hard to provide that opportunity in the community. And what I feel the most pride about is when people call mental health in the community, they're asking our clients for help. That's a powerful thing, and I'm very proud of that. And people like Wes and that have provided many services for people in need in the community who need some support, some lawn work, whatever it may be. And it gives people a sense of purpose. That sense of purpose that we take for granted that often isn't available for people. And that sense of belief that people can do things and expect things from people is a very powerful tool that helps people feel good about themselves, that we often take for granted, again, that a lot of our people don't have that opportunity and that ability to have a choice in life where you can actually go out and earn some money for yourself, have some respect, and have some skills. And the third thing I also believe in is the knowledge and the intrinsic knowledge that anybody brings to anything. Like for me, the idea of me being a handyman or being a yard person is kind of a joke, because my nickname in my first job was the Master of Disaster, because I literally used to go and I would wreck everything. I was like, wow. So now I'm hauling around like 2-stroke lawn weed eaters. Well, it took me about 3 years to get comfortable to even look at it. But you know who really got me through it? Was my clients, because they often go, oh yeah, that's a so-and-so, and you do this and you do that. And I go, oh yeah, I knew that, yeah. That's right. Anyways, I'm just really proud of the fact that we work in the community together and that our clients can work. And again, I want a big thank you to the foundation, and thank you to Lauren as well for supporting our program and allowing us to flourish. I really appreciate that. But I don't want to go on too much longer, because you guys have heard a lot, but I really would like you to hear from one of our clients what it was like for him, and now who's gone on to do a successful landscaping business. And actually, if you look in the hospital, a lot of the trees that have been trimmed and clipped, that was through Wes, and he's done really well. And I thought I'd leave the floor in closing with Wes.
Hi, it's good to speak to you. Struggled with schizophrenia for many years, and it took me even more years to find the right medication. But when it was there, Keith was there for me to encourage me, and he got me my first contracts, and I got a company through that and work with the hospital and in the community, and it feels great. Thank you.
Thanks. So we're just about done describing our services. We are building a vision for the future, and we'll be continuing to talk with the community about that as we go forward. And once again, I do want to thank the foundation for sponsoring this event, because I really think it's important for the community to bring mental health out into the open and to have these kinds of dialogues. So thank you.